If you live in America and are worried about your health insurance premiums skyrocketing, then you should be. Things have progressively gotten worse because the centralized healthcare system is unfortunately broken. I worked in healthcare for 20 years as a medic in the Army, then an LVN, an RN, then as a manager for a nationwide home healthcare company. And when I say things have deteriorated, I mean it. I believe a better choice for Americans is decentralized healthcare. And I'm not talking about how you receive healthcare. I'm talking about who controls your healthcare and the funding behind it. So let's take a look at the current broken system to see what the issue is. Now, here's a clip from Joe Rogan sitting down with Peter Tia and his sky-high bills, even though he has pretty great insurance. So just take a listen to this.
And then healthcare, like,
did you see the thing I posted a couple of weeks ago about this bill we got from when Jill was with our middle son in San Diego visiting a friend, and he was sick. So she had to take him to an ER, right? Like our doctor's not there, right? Obviously we live here. So they did like regular chemistry lab on him. That's like about a $12 blood test, and gave him like, I don't know, 250 to 500 cc of IV fluid. That was it. What do you think the bill was?
$1,200.
I don't remember it because I'd have to look at the post I put up. I think the bill was $6,000, of which we owed $2,000.
That's insane.
That's problematic.
That's a real problem.
Yeah, it might have been more than that. $6,000 bill. Our insurance somehow picked up maybe $3,500. We were stuck with $2,500. Now, juxtapose that with the following fact: fewer than 50% of Americans today, if given 24 hours, can produce $2,500 in cash.
Jesus Christ!
So, when we say healthcare is the leading cause of personal bankruptcy, it's the first, second, third, fourth, fifth. Like there's nothing else matters besides healthcare when it comes to personal bankruptcy.
So Dr. Tia is right. Why is it that the most powerful country in the world has so many people going through bankruptcy because of healthcare insurance? So we can just see here medical bankruptcies by country 2024. America is, of course, the leading. Now, across the world, we have other types of healthcare services, which are pretty much controlled by the government. Right now, we have the Affordable Care Act, and we're looking to see if we're going to be able to get subsidized by that to reduce the amount of cost, but it won't matter because healthcare costs will keep going up and people will still be going through bankruptcy because of healthcare and their horrible health insurance. And this is a piece here from Causes of Personal Bankruptcy. And it's not just that people are going through bankruptcy, it is the number one cause, just like Dr. Peter Tia was talking about. Now, there's other reasons you can go through it. So a divorce or separation, student loans, spending above your means, unaffordable mortgages or foreclosures. Of course, we saw that in the 2007, 8, and 9, a massive amount. But far and away, the number one is medical issues, even though many people have health insurance and they still are going through bankruptcy. And we can see that those rates are not just because of a specific time period. They just keep going up year over year. 2023, 434,000. Now, as far as year ending June 30th, 2025, you have 519,000, almost over 500,000 number of personal filings. And it's not just that people go into bankruptcy, but it's what they actually have to do because of the amount of debt that they accumulate because of healthcare costs. This is about a chart which talks about indebted adults who have done the following because of healthcare debt. It's not just, again, bankruptcy. That's 17% for this documentation here. But we take a look at what also they had to do if they didn't have just bankruptcy. Other people say, okay, well, I didn't have to go through bankruptcy, but it changed my living situation. I had to actually go through a charity nonprofit. That's 24%. Delayed buying a home. They had to take on extra work. They had to use up all or most of their savings, which is what I hear a lot of. And I used to hear a lot of that when I was in healthcare. And then also 63% people said, hey, I got to cut spending on food, clothing, other basics, because I can't afford this procedure. I can't afford this medication. And it goes on and on and on. And it's all about the healthcare insurance. And we can just see that your premiums have gone up over 15 years from the average around $15,000 annually to $25,000. And these will just keep going up even if we get the subsidies right and the Democrats and Republicans are able to work together. And because of the things that are happening behind the scenes, this is going to pretty much put it into context as to why insurance premiums go up each and every year. And this is from Real Doc Speaks. And it's all about medical loss ratio because of the Affordable Care Act. Just take a listen.
Why do our health insurance costs go up every year? Can we get 1 year where it's steady or God forbid they go down? And the reason for that is it was designed that way. There's something called in the Affordable Care Act called the medical loss ratio. Medical loss ratio means that insurance companies must spend between 80 to 85% of all premium dollars on medical services. That means they're limited to 15 to 20% for administrative overhead and profit. So that means that they play a little game. The higher the top line is, the bigger that number is. So now all we did was say, let's charge more each year. If you look each year, the insurance companies' revenues go up every year.
And he's right. So these things just happening year over year, and they will continue to happen year over year unless there is a major overhaul by the government. And I have to be honest with you, I have absolutely no faith in the government to do that, but we'll see what happens. And then, of course, if we take a look at it, as far as like the Affordable Care Act marketplace, it's only a paltry $91 to $111 billion that is being subsidized and brought into the insurance companies. So if you believe that Democrats and Republicans can come together and fix all this, that's fantastic, and best of luck to you. But it's under my personal belief that prices will only go up. I believe the system is broken, and I believe that we can all do better with decentralized health care. And before we get into that, I have to talk about why this actually works. It's because there's a game being played between the healthcare provider and the insurance companies. It's not just the insurance companies. This is Dr. Ashley Henry. And what she did, I'm not going to play the clip, but I will link this in the description, and also you'll have access to this presentation, is what she reached out to all these different MRI companies, diagnostic companies, and said, hey, how much is it for somebody who can self-pay? And she got a massively wide range of costs between $1,067 all the way down to $209. So why is it like that? Why do self-pay patients get these massive discounts? Because if you go and take a look at your bill for MRIs, and this was for a lumbar spine non-contrast, you will see that depending on where you're at and what your insurance is, and of course what the hospital is and the zip code and all that stuff, it could be anywhere from between $1,000 to $5,000 and beyond. So the question is why do self-pay patients only have to pay something like $209? It's very simple. It's because these organizations, these healthcare companies, they have to battle it out with the facilities, because they're going to say, the facility can say, okay, well, we got to charge the insurance companies like, $3,000, and the insurance companies can come back and say, we're only going to pay you $1,500. Okay, well, how about $1,750? And they go back and forth until they get some type of agreement, and then they get paid out. And this doesn't happen all the time, obviously, but that's what happens kind of behind the scenes as far as like billing. So for this, if you're an organization or you're a facility and you're like, I don't want to deal with the hassle of the medical insurance, what they'll do is if you're just self-pay, like, whew, great, I have to go through all these hoops. So I'm just going to easily enough just accept cash, and I have to go through the back and forth, and I get paid today, as opposed to a healthcare company who may pay me in 30, 60, 90 days and beyond. So with this, it really comes down to jumping through hoops. And it's all about who is in control of your healthcare. You're not in control of your healthcare. The healthcare insurance companies are. And it just states right here, insurance companies usually force patients to go through weeks of physical therapy, try medications, make doctors jump through endless hoops with prior authorizations, pre-certifications, or even peer-to-peer calls just to get approval for this type of scan. So they're going to say, like, look, you don't need this scan. You don't need this procedure. We're going to have you do this before we give you access to this other part and pay for this other part. So essentially what they're doing is they're bypassing the medical doctor. They're bypassing your wishes to say, no, we think you need to do this because of whatever different standard that we have. And because of that, you have to jump through all those hoops. And when you finally get the green light, they'll charge you whatever it is, $2,000, $3,000, $5,000 for a test that would have cost around $200 cash. Now, of course, your premium, you'll have to pay for that, and it may be lower, but it's all dependent on your insurance. So the question is, if they're going to make you jump through endless hoops and these prior authorizations, they should approve everything, right? No. This is a claim denial rate by insurance companies. You think with all that stuff, they would approve everything. But the industry average is 16%. They say you don't need that. United Healthcare, which is what I used to have, they actually denied 32% or a third of all claims. Now, I didn't personally have that issue, but apparently this is an aggregate across a host of different cases. So just remember this when you're thinking to yourself, my insurance is pretty good. How many times will they deny you? And it's really, in my opinion, it's time to opt out of this system. So this is where it comes down to CrowdHealth. This is from PH Wim or Peter White. He says, first time fully submitting a bill on CrowdHealth. Wild experience. Almost $2,000 for the emergency room, submitted for reimbursement. They had my funds in my account within 14 days. I transferred the funds, paid the bill. Would have paid $3,000 with my premium health insurance, paid $500 instead. So how does this work? How does decentralized healthcare work, and how does this work with CrowdHealth? First of all, there's a lot of different companies besides CrowdHealth. I'll give you a link and you can compare all those different companies. But as far as a decentralized process, we have to kind of think to ourselves, what is decentralization? And I think it comes down to, if you're a Bitcoiner, you know the power of decentralization. So there's centralized systems and decentralized system. The easiest way to think about decentralization is just take a look at the banking system. So really what it comes down to is who's in control of your money. Central banks are, and what they do is they loan out funds to banks, so they're perpetually in debt, and then they get to go to you. You're never really in control of your money, and they pretty much can state like what and how things actually operate, as opposed to Bitcoin, where you have this in a decentralized network. There are node operators. There are people that mine Bitcoin. We say it has value because it's between millions and millions of people globally. And you are in control of your money. You can spend it any way you want to. You can transfer it across the world in under 10 minutes, which I don't understand why they can't do that now in the banking system, but you are in control of your money. And it's the same thing with your healthcare. In centralized healthcare, who's in control? Well, it's the insurance company. They're saying what you can and can't do, and that's pretty much it. They're going to tell you which doctor you can see, which procedure you can have or can't have, emergency room services, and of course, the big one, medications. So with the decentralized healthcare, who's in control? Well, you are. You're going to be able to say, okay, instead of them being in network or out of network, I'm going to see this, and this doctor. I'm going to see this, and this specialist. I'm going to have this procedure, whatever ER procedure I want to have. And then also the medications, I'm going to get to choose what it is. And it's not going to be a debate about you telling me, oh, well, you have to use a generic versus a retail. You get to control your own healthcare. And the individuals that are within your network are the ones that help to fund it. So with CrowdHealth, they're relatively big company. Now I think that says 13,000 have signed up. I think now it's over 17 or 18,000. There's a link for all the different reviews, and these are reviews as early as November 22nd, 2025. So very recent. But as far as like people would say, well, you know, all these people that are in it, you know, 16, 17,000, whatever it is these days, how does that work with funding? Because if I have something catastrophic happen to me, is there a limit to that? Well, no. On their website, you can see exactly how the funding actually works and how much they've actually paid out. So here we have examples of $272,000 bill for a member in North Carolina needing help paying for stage 4 melanoma. Here's one, $331,000, a bill for a member in Oklahoma needed help pay for a NICU event, the neonatal intensive care unit. Funded $267,000 for help with a car accident, $122,000 for a cardiac event. And again, links in the description. You can see there's some pretty good stories here across the board between $60,000 and $240,000. One was an accident, newborn in the NICU, small business for a cardiac event. And they just released a really good one for an individual who was fighting cancer. And they funded that, or the decentralized network of healthcare funded that for $200,000. So how does this work? Because that's the big story, the big question. Well, there's 3 steps to it. First of all, you subscribe for $60 a month. Pretty good, huh? Step 2, you want to choose the right membership for you. And what is that? What is that membership that you can choose, which makes a lot of sense for you? Well, there's 2 different options. I personally went for the original. CrowdHealth Original, it's $500 per health event. And there's also one called Black Swan, which is $15,000 per health event. To me, I kind of look at it like original is like kind of like the standard for insurance that you would need to go to a doctor, you get the basic things, and most of the things are covered. And then for what's called Black Swan, I kind of picture this as more of like a catastrophic event only, and you want to pay less premiums. But the thing that gets me is what is this per health event, and what does that mean, and what are these events themselves? Well, A per health event would be like an illness or an injury. You get strep throat, your kid gets the flu or something like that, you have to go to the doctor, treatment, medication. That is one of the health events. Or if you need surgery, pre-op, anesthesia, maybe you have to go to a rehab facility for post-op care, chronic condition management. Let's say you have CHF or congestive heart failure, or you have asthma, or you have some type of COPD. You need ongoing care, like for medications, beta blockers, Lasix, all that stuff. Emergency room, you go, you have some problems. Diagnostic procedure, like we talked about, MRI, X-rays, ultrasounds, and cancer management, medication, surgery, and all those things. So when they talk about health event, 500 versus 15,000, multiple bills related to the same health event count as a single event. An example would be you fall, you break your hip or whatever, and you go to the ER, and then you have to have the treatment, then you have to have the surgery, then you have to have post-op, and you have to go through rehab. That is one health event that is counted as a single event. So pick, which one is more applicable to you. If you want to go just $500 per health event or $15,000, again, it's decentralized healthcare, so it's what you think is best. But there's also some differences between the OG and Black Swan. First of all, it's the same thing across the board as far as the crowdfunding for eligible medical bills. They will actually help for negotiation, CrowdHealth. They will call the surgery centers, call the hospitals, call the ERs and medication companies and say, hey, look, we are only going to pay this much. And because we are self-pay, and we're going to bring those prices down, just like we saw in one of the original slides. And that's what they do. They help to bring the overall cost out. And then the crowdfunding helps with the decentralized healthcare, and then they pay it like that. Personal care advocate, same thing. You can also find a doc on their websites, and then prescription discounts, which are pretty decent, but there's actually better options, and we'll talk about that in a second. Now, the differences. There's a bunch of them. Annual wellness, maternity support, virtual care, quarterly specials. And also they have a fold and Bitcoin savings program, which they pay for, and a longevity discount. So let's break those down in detail. So the first thing, again, this is the difference between the original and the Black Swan. Annual wellness checkup is available for original, not for the Black Swan membership. Each year, you're eligible for up to $300 in funding. Primary care checkup, lab work, gynecological exam, pediatric visit, whatever you think it is that's good for you for your annual wellness, you pick what that is, and they reimburse you $300, which I think is pretty good just to upkeep your health care. Maternity support. You pay the first $3,000 in maternity expenses, and the rest is eligible for crowdfunding. So everybody pregnant out there, it's kind of important. This is not available in the Black Swan. You also get unlimited virtual care, access to an unlimited number of virtual doctor visits. You say, I'm feeling pretty sick. Instead of going to an ER, urgency care center, I'm just going to go through a Zoom meeting, talk to a real doctor, go through the rigmarole and the different symptoms, and they can say, you might have this. Here's what I recommend. Here is the prescription. With just a few clicks, speak to a doctor from comfort of your home. And then also pretty good if you have any type of issues, depression, anxiety, you just need someone to talk to, you have unlimited virtual talk therapy. And that is available to the original, not to the Black Swan membership. And this is, I think, a big one. And I'll be using this myself, quarterly specials. And this is important because it's important we understand your body, our body is the first step to take control of your health and figure out what we are healthy in and what we need help with. It's important to keep yourself healthy as opposed to going down that road, getting sicker and sicker and sicker. And that's pretty much what healthcare is these days. It just helps you when you're pretty much falling off a cliff, and not really so much as far as keeping you healthy. That's what I like about this program. So past specials they've had is coronary artery calcium scores, gut health test, DEXA scans, which is a very non-invasive procedure. It's like a 10-minute thing where it can show you like how much visceral fat that you have and everything in between. Pretty good stuff. Fasting insulin test and VO2 max assessments, and those are available with the OG. And then of course you skip or you choose between the original or Black Swan. And of course, step 3 is the contribution, where you actually help other members. And this is where the decentralized aspect comes from. So the contribution max is different from the advocacy fee. Just like we talked about, every month for one person, an advocacy fee is $60. So it's just you're under 55 years old. Contribution is $140. That's the maximum that will be asked for you to fund every month. So you're going to pay $200 total. Now, of course, this is what you pay out. Now, when you go through something, let's say that you have an ER procedure, something happens and you need to go to the emergency room. You need a surgery. I mean, God forbid, cancer or some type of other type of thing. This is where you will ask, or actually you'll submit this to CrowdHealth, and they'll contact all the members and say, okay, the contribution every month, we're asking you for this, and then you will pay for everybody else's procedure, and just like you do every single month. So the question then is, well, this $140, is this what I have to pay every single month? No, it is not. This is just what CrowdHealth is asking all of its members in this decentralized platform to pay. But not every month, people will all be sick. Some months, people that 16, 17,000 that are in this program right now, they say, you know what? There's been no submissions for people to go to the ER to get a diagnostic procedure, whatever else. We only need $110. So on average, and this will vary, you can check this out, link in the description. For the advocacy fee for this one was $60. Average crowdfunding ask wasn't $140, it was actually only $88.75. So their average monthly total is $143. So usually you're not paying that full $140 contribution. So there is a difference, though, obviously, between your member level of the original versus the Black Swan. So this tool, you can do this yourself, but just to go through this real quickly, let's say you have two people. Well, advocacy fee is $60 plus 60 because there's two. That's $120. And the contribution is $140 plus $140. So you're paying $400 for two people under 55. Three people, $180 and $420. Four people, $240 and $420. And that's the cap. You can't go higher for the contribution level for people under 55 above $420. The monthly total is $660. So a family of four, that's how much you're paying. And then it'll go up a little bit as far as like the 5 if there's a advocacy fee, but the cap again is capped at $420. But what if you are 55 years or older? Well, again, advocacy fee is the same, but the contribution is a little bit higher because elderly individuals, they're going to have them pay a little more, I know. However, $125.60, and then the cap is roughly $700 in the advocacy fee. So again, you can go through this tool and figure out which one you will fall into. And also there's a tool to compare against your current healthcare cost. Now then, let's take Black Swan, $15,000. Why is it so high? It's because your contribution is so low. Advocacy fee is still the same at $60, but the contribution is only $25. So let's say you have two people. It's $120 for the advocacy fee, contribution $25 and $25. But the cap is $75. Not too bad, right? And that is essentially how much you're going to be paying if you're going down this road. And of course, if you have people 55 or over, it's instead of 25, it's 50 and 50. So again, just choose which one, of course, is best for you. Now, there is a link in the description for an affiliate, which I am one for CrowdHealth. And actually, anybody who signs up can become an affiliate, and they just get a code. Now, you don't have to use this affiliate code, but if you do get 69% off for your first 3 months of your contribution level. So just be aware, you do not have to use it. You can go right to joincrowdhealth.com, but you don't get the discount. And then also, if you're 55 or older, there's even greater discount. You get 84% off for your first 3 months for your contribution. Now the monthly total is only $104. So there's some caveats I'd like to talk about for this program. And when I downloaded the app and went through the whole process, very simple. But when we're talking about this contribution, so in the app itself, what happens if some people are asked to pay that $140 or $280 or how much they have for the contribution, and they just decide not to pay it because they say, well, I don't want to really help anybody. Well, you're not participating in the community. You're not really helping out. So when that happens, there is this thing called decline red events. Automatically deny crowdfunding requests rated red. These requests fail to meet fair marketing pricing or come from members with low generosity scores. reducing risk for you as a contributor. So again, if you're going to come in and say, I'm only going to pay the advocacy fee of $60, you can do that. But then to actually get contributions for people to help to pay for your health insurance, it may not happen. Now, having said all that, we all know that there are some months that just don't work out for us. They're difficult, we have issues, and we can't make a payment. This auto decline red events only becomes red if you fall under 90% of the contribution. So let's just say 1 month out of the year, you're like, you know what? I just got too many things going on and I can't pay. And you can't pay. And this is one of those things where it says you will still be in the green, meaning that you have been contributing, but maybe just a month or so, you've had a tough chapter. And that's essentially what's happening with the declining of red events. So you may ask, well, with all these things going on, how does CrowdHealth actually be able to pay for this? Because some of these payments are outrageous. And the answer is they don't. Again, like we talked about, they will go to those facilities, to those operating centers, surgical centers. They will go to these different healthcare facilities and say, look, we're not paying that. Whatever your cost you think it is, we're going to go lower because we're all self-pay. You don't have to deal with the insurance companies. You don't have to deal with waiting. We're going to fund it, but you're going to give us a massive discount. And that's pretty much what they do. So like in this situation, the NICU, neonatal intensive care units, the build price is $125,000. They talk them down to $30,000. 76% savings. And of course, that gets funded by the community itself, decentralization. Now, if you're thinking to yourself, I don't know about this, Rob, this looks a little bit scary, and I can understand your reluctance. So there is a tool you can use to compare your insurance policy costs. And there's a link right there, and you can go across the board and it'll talk to you about what the monthly costs are, not just the advocacy fee and contribution, but you can compare that to an out-of-pocket expense, co-insurance after deductions and deductibles to see which one is best for you. And like I said in the beginning, CrowdHealth is not the only one. So I'd like you to compare that against other ones that are decentralized, like MediShare and Altura, Solidarity, Samaritan Ministries. And there's a link. You can compare all those together and see which one works for you. And then before we wrap up, there is a couple of questions, which would be, what is this Fold and Bitcoin savings program and the longevity discount program to these different processes? So the two things that they also are available, again, this is only for the original CrowdHealth. They are a little bit different. So with Fold and the Bitcoin savings, what Fold is, it is a Fold debit card, and you can buy and sell Bitcoin with 0 fees. And then you can use that debit card where you can use up to 50% on top merchants, up to 1.5% reduction on different categories. You can boost rewards as you're shopping for travel or clothes on the internet, and up to 0.5% on everything else. And this is actually about $100 per year. And CrowdHealth will actually pay for that, which is very nice. Try Fold and use that. But for Fold, just so you know how this works, is that you will automatically transfer the difference between your monthly crowdfunding maximum and your actual contributions directly to your Fold Plus account. So remember when we talked about that if your contribution is $140, but usually it's only the average is about $83 or $85. What they'll do is say, hey, instead of you doing that, we're going to actually put this automatically into your Bitcoin Fold account, where it'll transfer over into Bitcoin, and you can use that to pay for things. And if you're into that, that's fantastic, and you can do that. Again, the monthly ask versus what the actual ask is a little bit different. But the other one, the CrowdHealth longevity discount program, I think is much stronger and probably something you would want to participate in. You actually get 20% off your contribution, and that's of course 20% of what you actually pay. So if you're paying $140, then it goes down to like $85. You get 20% off of $85. So you're roughly paying only $70. And how do you do that? Well, you pick 2 out of the 3 different tests, and that'll tell CrowdHealth how healthy you potentially are. One of those is a DEXA body scan, again, where you just go through, get scanned, takes 10 minutes, and it'll tell you how much visceral fat you have. If you meet a certain threshold, great, there's 10% off. You can go get C-reactive protein, which will tell us how much inflammation your body has. And that's just a lab procedure to draw some blood, very simple. And also another lab procedure is insulin sensitivity. So pick 2 out of those 3. If they're below a certain level, you will get 20% off. And it's very easy to do. You just use your app. You upload the results, create an event, submit the bill, because they actually pay for the lab and the DEXA lab. And they'll pay for that bill and give you 20% off. And that's the longevity program. So also, how do you cancel your membership? Well, a good thing about this, which kind of beats out the traditional healthcare, you can cancel your membership at any time. Cancellations are effective at the end of your current billing cycle. Also, what about international travel? Because this is great in the States, but what happens if I'm, I don't know, in Spain, or if I'm in Dubai or something like that? Well, international care is eligible on a valid health event, but will be fair market price compared against similar or reasonable standard of care services in the US. One big caveat, air ambulances, medical evacuations are not eligible for crowdfunding, but past that, if any kind of procedures need to be done, any kind of medication, CrowdHealth will act, we can pick that up. And then prescriptions, that's a big thing for a lot of people and what they're actually taking. Prescriptions related to a specific health event occurs when you're a member. You are available for up to 12 consecutive months. Longer than 12 months are not eligible for crowdfunding. And for medications, I actually put this to the test, and I found out that actually the pharmacy that was recommended was not the best. And this is what CrowdHealth says. It says 40 to 60% off at your pharmacy with a pharmacy partner. And the link was Medalist RX. And this is a pharmacy locator where you can go to a whole host of different pharmacies and get your medications, whatever they are, and they'll pay for those up to a certain amount. But what I found was that actually, if you just went to the website Cost Plus Drugs or GoodRx, it actually beat them. But if you want to try this out on the app itself, you just click on the digital RX card. It'll give you a code, and you show that when you go to the pharmacy of wherever you look up your pharmacy itself. So I tried this actually. And I took a look at, I picked an example from the chronic condition management of congestive heart failure. And what usually is used, a trifecta of Entresto, beta blocker, or Lasix. Actually, it's probably spironolactone, which is like a potassium sparing diuretic. But anyhow, so for these 3, I took a look at Entresto, 49 to 51 milligram tablets. And for a quantity of 30 from the recommendation from CrowdHealth, it was $325, which is kind of pricey, I might admit. So when I took a look at, say, Mark Cuban's Cost Plus Drugs and also GoodRx, it was only $16. And the other one for GoodRx was $97. So it's something to take a look at. I also did this for somebody who has COPD or an asthmatic. I used the example of Symbicort, and the amount they gave was $1,158. Cost Plus Drugs, $182 and $97 for GoodRx. So this is the great thing about you being in control of all of your healthcare, is that you are able to find a lot of different things and use the self-pay and not have to jump through so many hoops. And that's one of them. So after talking about all that, let's talk about who this is not for. This is not for, as far as CrowdHealth, is not currently open to tobacco users. So if you smoke, sorry, you can't be a part of it. If you weigh over 220 for a female or 260 pounds for a male, this is not for you, and you are not eligible. And then also, a big one, how do you handle previously diagnosed or documented health conditions, pre-existing conditions? So for previously diagnosed or documented health conditions, no costs associated with the condition are eligible for crowdfunding in the first or second year. So if you come here and you say, hey, I have COPD, congestive heart failure. Okay, well, since that's a pre-existing condition, we're not going to cover that. Now, on the 3rd year of membership, up to $25,000 to bills per year related to previously diagnosed or documented health conditions may be submitted for crowdfunding. So unfortunately, for pre-existing conditions, this is not for you. This is not for everybody, but I think it is for a good amount of people, and we'll see. And then also, how do I pay for big healthcare events with CrowdHealth, like we talked about? So for big planned bills like surgeries, CrowdHealth will negotiate the cost to a 36% discount, like we just took a look at for the NICU. And that's for every different cost before the procedure event even happens. So emergency bills, we'll work with our partners to negotiate them after the fact. There is no maximum amount of healthcare costs you can share with the community. And what is not eligible for funding? Cosmetic procedures. When I get a facelift, sorry, it's not going to be covered. Long-term prescriptions, fertility and infertility treatments, and procedures and treatments tied to a pre-existing conditions, not eligible for funding in the first and second year of membership. So you might have some more questions. And I try to be as comprehensive as I possibly could. But what I would highly recommend is, if this sounds something for you, and as we went through everything, you should book some time, talk to a real person, and really get the lay of the land and say, is this really good for me? Because I've got this X, Y, and Z question. Again, links in the description, make that appointment, talk to a real person. So for me, my personal experience, for me to sign up online took 5 to 7 minutes. Just did a screening and just said, hey, are you pregnant? Good for me, I wasn't. Are you using tobacco? I didn't. And then also, do you live in Vermont, Rhode Island, Massachusetts, New Jersey, California, or DC? Because if you do, because of the Affordable Care Act, some of these states will actually give you a penalty because CrowdHealth is not insurance. And in those states, I know for California for sure, it's either $695 fee or 2.5% household income because you don't have centralized insurance-controlled insurance. And because of that, we're going to fine you $695 to 25%. Now, I think in other states like Rhode Island, they just say, hey, you really need to have insurance, but they don't give you a specific fine. Again, what I would do is contact people at CrowdHealth, book some time, talk to a real person. And then also for taxes, these amounts are not tax deductible. Just so you know, legal action in the case that a provider bills an unfair amount and is unwilling to negotiate, CrowdHealth requires members to give us the right to pursue legal action against that provider on behalf. I have to tell you, that's pretty good. I'll let them do the hard work and I'll be out of it. And again, for me, when I signed up, it made this clear like 3 times. This is not health insurance. And I would click on I understand. But I have to tell you, to date, 99.9% of the bills submitted to the community have been fully funded. That's a heck of a lot better than what the insurance is doing as they deny claims left and right. I reviewed disclosures, clicked on I understand, and bam, as of December 11th, I will be a member. I sign up on November 11th, 2025. So here's the pros and the cons that I can see with decentralized healthcare. Number 1, you're in control. If you like being in control, I think this is for you. And of course, there's massive flexibility. And really, to get out of the system, just like a lot of Bitcoiners do, this might be for you. Number 2, you got lower monthly costs. Again, there's a tool to check over that to see which one it is. Again, for healthy individuals, pre-existing conditions is, again, like we talked about, not covered. It's ideal for certain demographics. And I think a big thing for small businesses, I mean, imagine being able to do this with your employees for small businesses instead of having your rates go up every single year. Number 4, traditional insurance costs usually increase year over year. We've seen that. I've seen it massively over my time in healthcare. And now as I'm out looking for healthcare as somebody looking in. And 5, predictable monthly costs, finally. It is scary when you go and have something done and you have a surgical procedure and you go through everything and the insurance is like, don't worry, we'll handle it. And then a month, 2 months later, you get the bill and you're like, what did you guys cover? Because now I'm going into massive debt. And then of course, as we talked about, bankruptcy. The cons of decentralized healthcare and crowdfund is that it is not traditional insurance. There's legal ramifications. And of course, there is also things for taxes, which you can write off, which you can't do now. It's not for everyone, like we talked about, pre-existing conditions. The first 2 years, they're not eligible, but after that, up to $25,000. There's also state regulatory constraints, like we talked about. And that's a pretty hefty bill to pay every single year of $695 or 2.5% of household income. And of course, number 4 is there are upfront costs, which means you have to pay for the certain aspects of going to the doctor, having the procedure, all those things, and then you get reimbursed by the decentralized community as they pay for these things and it flows into your account. And lastly, as far as cons, I don't know if this is really a con, but it is a new company. It's been around since 2021. It has grown pretty fast and it looks to be doing good things. But as far as companies go, it's not 50, 100 years old. It's been around since 2021 with some amazing reviews. And that's it for today. So look, I know that was an incredibly long video, but healthcare insurance is one of the things that you really can't overlook. And it's going to take a lot of time to really digest all the information. I recommend watching the video again or just reaching out to CrowdHealth if this is something that you think is for you and booking some time. That's it for today. Thanks so much, everybody, for stopping by. I appreciate you, and I'll see you on the next one.